Good morning, folks. My name's Ron Ray with Turning 65 Solutions, and today we are going to talk about Medicare Part D in 2021, how it's working, what the deductibles and copays may be. And so this is January 2021. Our reference today is this book right here called Medicare and You 2021. So you're getting fresh information. It's coming right out of this book. So let's get right into it. One thing that original Medicare nor Medicare supplements cover is prescription drugs. Prescription drugs are covered under a separate program called Medicare Part D. It's real easy to remember, folks. Part D, D for drugs. So here's how these work. There's a whole bunch of them, and we never know which one is right for anybody until we do one thing. We take your list of prescriptions, however long or short that may be, and we plug those into the Medicare website right down here, medicare.gov. And it's a public website. You can do it on your own, but we're happy to help you with it. So what we do is we put your list of prescriptions into the website, and that website takes all of the drug plans that are available in your area. Where we're at here in Texas, there's 30 of them this year, and it sorts them. It sorts them based on your total out-of-pocket cost for the whole year. Now that includes your monthly premiums for the plan, plus any deductibles that may be required, plus your copays when you go to the pharmacy. It adds all of that up, and then it tells us what's your actual bottom line out of your pocket for the whole year. And then, because all the pharmacies pretty much take all of them, but we'll know because we can select the pharmacies as well, we just go with the cheapest one. There's no need to pay more premium for the same services. So as long as your pharmacy that you like takes it and the plan is available in your area, we just go with the one with the lowest out-of-pocket cost for you for that year. Now that process, we have to do that every year because these plans, unlike Medicare supplements, these plans change every year and everything about them can change. The copays, the premiums, the deductibles, the formularies, and your prescriptions can change. The doctor can put you on something different. So if we see here with this example, we don't have a premium here, but the range in premiums is vast. It goes from about $7 a month in 2021 to almost $200 a month. So in all 30 plans from 7 to almost 200, there's a big range, and having a more expensive plan doesn't necessarily mean it's better for you. Okay, so it really is based upon your prescriptions. So how they work is you pay a monthly premium, and then there may be a deductible, which could be as low as $0 or as high as $445 for this year. And then after you've met your deductible, which may be $0, well, then you just pay a copay when you go to the pharmacy. Now, these aren't the real numbers. These are just made up, just for an example. But most of your generic drugs are going to be very inexpensive. In fact, most of them will be free. And then as you go up the tiers into the non-preferred generics, the preferred brand names, non-preferred brand names, the specialty drugs, they can get pretty expensive. And in fact, they can really be expensive. So it's very important that you do a good, thorough evaluation when you're making this selection so that you make a wise, well-informed decision when you're turning 65. And then again, every fall after that. So here's what usually happens. You can change these plans once a year during the annual enrollment period from October 15th to December 7th. You have an opportunity to change plans for a new plan starting on January 1st. So what happens is the plan that you have comes in and they says, you know, this drug that we had at tier 2 and you were paying $42 a month for it, well, we weren't making enough profit on that drug at tier 2, so next year we're going to move it to tier 3 and you're going to pay $91 a month for it. Well, guess what? Company number 2 over here, they didn't make that change. They still have that drug that you're taking at tier 2 at a lower price. But once that December 7th deadline passes, you're now stuck with that plan for the whole next year, paying that higher price. So all you have to do is bring us your list of prescriptions, and we will do that evaluation and make a change for you and keep you hopefully at a lower price. Now, finding the right plan is the tricky part. Once you have it, it works pretty much like what you're used to with a premium, deductible, and copays at the pharmacy. In another video, we're going to talk about something called the Medicare Prescription Drug Plan donut hole, or the gap in coverage. That'll be shortly after this one, but I just wanted to kind of save that for a different video because I want to go into good detail on it. I don't have time here. So keep an eye out for that. It's coming, the donut hole video. And if you have any questions about Medicare Part D, give us a call. The number is 830-217-6711, or find us on the web at www.t65s.com. Until the next video, have a great day, folks. Bye.